how are you today?
I'm doing good.
I'm Allison. I'm going to be your student physical therapist today.
Okay.
So I know we're here today because you have some lymphedema going on in this left arm. And last time we met, we did the manual lymph drainage. So now this is kind of going to be like the next step to that because we already went in and we decongested that area. So now we just want to maintain that decongestion with our bandaging process. So I can go ahead and explain that to you. We're going to start our treatment. Do I have permission to touch?
Yes.
All right, awesome. So pretty much what the bandaging is going to do is we're going to wrap your arm up, and it's just going to start, that pressure is going to start pushing that fluid up so that we can just keep on decongesting that area and start reducing that edema.
Okay.
So first what we're going to do is we're going to put the stocking on your arm. Then we're going to take this gauze and we'll wrap it around your fingers, and we'll make it where you can still, bend your hand and like be able to eat and use your hand throughout the day. Then we'll take this foam stuff right here, and we're going to just wrap it around your arm so that it'll be more like a comfort, but also we want your arm to be the same size throughout, because that's going to make it easier when we get to the next step, which is we're going to take this, and this is going to be more of the compression part, so we're going to wrap this around, and that'll be that pressure that starts pushing that fluid.
Okay.
So before we start, there's a few things that we need to clear you to make sure that we can do this. So do you have any heart or lung problems? Have you experienced anything like a deep vein thrombosis? Do you know of any arterial insufficiencies that may be going on? How about cancer or any recent infections? No? Okay. So the next part is we're going to check your sensation, and I want to just check your skin and make sure we're not, doing harm to anything on your skin.
Okay.
So what I want you to do is I'm going to touch you like this. So I just want you to say yes when you feel it. So go ahead and close your eyes.
Okay.
All right.
Yes. 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 Yes.
Okay. That looks good. Now I'm just going to look at your skin. Just look at your palm and in between your fingers. Go ahead and check this hand out. Alright, everything looks good. Looks like we can go ahead and get started. So, and do you have any questions so far with this? Alright, so I'm going to you can just kind of pay attention while I'm doing it, and then I'll go back through it with you, and then you'll just kind of learn how to do it by yourself, so you can just be taking it off and on whenever you need to. So we'll put this on, we're going to go ahead and roll that part up. What we're going to do first is we have to wrap around the wrist to anchor it off. And while you're doing this, you want to avoid putting anything over this bone right here.
Okay.
So then you're just going to come to the inside of your pinky, and you want to start at the top, but leave your nail bed exposed so you can see that. And then you work your way down. And then come around your wrist. And then you're going to come to the inside again. Going to be the most tedious part of the process. Once you get this mastered, you should be good. You can relax. A little bit left, so I'm just going to put it up here, and then you're going to tape it off. Okay, so can you like bend your hand and bring your fingers around? Okay, good. So the next part, we're going to bring the stocking down. I'm going to put that in between the thumb and the pointer finger. And we're going to start with our foam stuff. So you can just stretch your arm out if you want to just kind of leave it on my stomach. And what we're going to do is just start wrapping this. Try to get your arm to be as even as we can. And with this, there's no real rules of what you need to do. You just got to try to make it even. So like down here, we need to do a little extra around your wrist. Bend your elbow for me?
Mm-hmm.
Okay. Make sure it's good and padded right here where your elbow bends. Okay. Now we have that taken care of. I'm just going to be putting this on. So at this point, we don't have anything on the palm except for now we have this stocking, and now we're going to kind of start making that go through the thumb and the pointer finger. Alright, so if you want, you can go ahead and place your hand kind of at my stomach again. Alright, so start this way again. And then we're going to anchor it like we did last time. And now, what we're going to do is, since it's kind of thick, you're going to have to make a little crease in it. And you can make another little round, and then do the same thing. You can just do this 2 or 3 times. Alright, go ahead and put it back here. Now we're just going to start going up your arm. Can you bend your elbow? Okay, we're going to go ahead and take this one off. So we want to end on your elbow. We're going to start with our longer one, and what you want to do is start this one the opposite way that you started the first one.
Okay.
So now we're going to start this side. Start here. Can you bend your elbow again? So with the elbow, you kind of want to do something that's like a figure 8. So you're just going to kind of come up. So I can make sure I don't mess it up. We'll make that a little loose since we had to kind of double it. And now we're just going to take this part up. Nice. Alright, so I just want you to try to bend your elbow, try to act like you know, make sure you can reach your mouth so you can still eat with that hand if you need to. Okay, everything looks good. Do you have any questions about this at this point?
No.
Okay, so there are a few things we should go over. I went ahead and had it printed out for you so you can just take this home and just be able to address it if you need to. Pretty much we need to look at the fact that you don't need to be wearing tight clothes with this arm, and you need to avoid hot showers when you're showering. Also, try to put like a plastic bag or some type of plastic over this garment so we don't get it wet or anything like that. Also, don't lift any heavy objects with this arm, and then if you start feeling any numbness or tingling, that is not good, so we need to go ahead and you can just take it off. And also, if you look at your fingers, see right now, your fingers look good. They look like a normal color, and your hand does too. So if at any point you see any discoloration, then definitely go ahead and remove the bandage. And I'm going to teach you how to do it too, so you'll always be able to put it back on if you need to.
Okay.
As far as lotions and things like that, hypoallergenic is important, and also like a neutral or a low pH. Garment care, we're going to want to wash this daily, as much daily as possible that you can do, and you're going to hand wash it, you're going to lay it out flat to dry, and these need to be replaced every 6 months.
Okay.
So if you have any questions about that in the future, see you next time.
All right. Thank you.